Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq, and today in infectious medicine we will talk about the very common disorder infectious diarrhea. And acute infectious specifically we will talk about in this section. So acute infectious diarrhea is our lecture topic, and we will cover this topic in 5 different sections. In the first section, we will talk about the pathogenic mechanism of the infectious diarrhea. What are the clinical manifestations, pathogenic mechanism, how it develops, what are the factors that contribute to the development of acute infectious diarrhea, and also the role of toxin production and invasion of different pathogenic microorganisms that lead to acute infectious diarrhea. So that all we will discuss in the first section of our lecture topic. Then in the second section, we will talk about some host defense mechanism that are important in the prevention of infectious diarrhea. And if those host defense mechanisms are not functioning properly, what are the different disorders that can occur. So first, we will talk about the intestinal microbiota and gastric acid. These are the important defense mechanism, host defenses. Then we will discuss about intestinal motility and immunity, and also some genetic determinants as a host defense mechanism. Then in the third section, we will talk about how we should approach to the patient. And whenever we approach to the patient, very important is the history and physical examination of the patient. Then we should go for some diagnostic tests. What are the diagnostic approaches we should do? And then also post-diarrhea complications. What are those complications and their management? Then in the fourth section, as far as acute infectious diarrhea is concerned, epidemiology is very, very important because it is common in people who travel from one area to another, and they should do some precautions before traveling. So that's important. So travel history and location is important, then age and host immune status, bacterial food poisoning. And then in the fifth and final section, we will talk about the lab evaluation of infectious diarrhea, inflammatory disease evaluation, and treatment of these conditions. So all that we'll discuss in today's lecture, and that we will talk all the important topics associated with acute infectious diarrhea in detail today. So to cover this very important topic, so you should be very completely aware of this acute infectious diarrhea. So keep watching sqadia.com to learn about this topic.